This is the way to do a shoulder examination in your clinic, and it's a simple 5-step shoulder examination which will help you pick up most of the pathologies. The first thing is you must stabilize the scapula, and you ask the patient to do their active movement. So flex karo. So where it stops, straight. Yep. So where it stops, then you do a passive movement beyond that. That way you can see if they have a frozen shoulder or not. So अगर आपका passive movement is more than your active movement, by definition you can't have a frozen shoulder. For a frozen shoulder, your active movement must equal passive movement. The same thing we do from the side. We do their abduction actively, कहाँ तक जाते हैं, then where they stop, then we again check their passive movement. And it's important to document all these things. The next step is you start at the clavicle and you feel out till the acromioclavicular joint. यहाँ पे pain हो रहा है? Okay, so that tells us ki do they have AC joint pathology or not. The next step is we feel the biceps tendon anteriorly and we ask them, is this painful or not. Okay. The next part of the examination is we check their impingement sign. So for this we do the Hawkins-Kennedy test. We get their arm in abduction and slight internal rotation, and then we elicit pain. Is that painful? Yes or no? And then we slowly move up so we can differentiate between shallow impingement and deep impingement. Then with the arm in 30 degrees forward from the back and the thumb pointing down, we ask them to move their hand above. So amna jor lagao. So this is Job's test, and this tells us whether they have a cuff tear or not. Now some patients may have massive cuff tears jinme they don't even have a little bit of movement. In that case what we do is we lift up their arm and then we ask them to hold the hand there and you catch it. Now in patients that have massive cuff tears, the hand will just drop down and you have to catch it. So this is your basic examination of the shoulder, which will help you pick up the majority of pathologies, including rotator cuff tears, AC joint pathologies and biceps pathologies. Okay, so this is the way to do